So now we talked about the theory, we saw how it is in practice. Now let's talk a bit about the protocols, who is a good candidate for this, who is a good candidate for that. And then Dr. Antonio is going to talk about transplantation, and I will mention a few things about the exome, the exosomes. So I'm going to talk about who is the right candidate for PRP, and Antonio is going to talk about who is the right patient for SEFI. So in regards to PRP, why some patients respond better than others and to PRP? So we need to remember that not all patients respond equally to the same treatment, and clinical outcomes depend on many things. First of all, the disease stage, the degree of miniaturization, the presence of fibrosis and inflammatory burden, the age, hormonal factors, and treatment adherence. And the key question is don't ask yourself why does PRP work? Ask yourself which patient is most likely to benefit from PRP. So patient selection is crucial when it comes to choosing the right modality for regenerative therapy. And I would like to show you two cases of mine. One is a good indication for PRP. The second one is not a good indication for PRP, or not enough, and it will be a good indication for SEFI. So my first patient is the ideal candidate for PRP. He's male, 32 years old, with Norwood 3 vertex, with active miniaturization in microscopy, with preserved follicular density, no visible fibrosis, and early progression. So he's 32, he started to see hair receding 2 years ago only, so it's 2 years into the disease. The baseline finding was increase in shedding, reduced shaft diameter, and good follicular reserve. And you can see this is his trichoscopy from the vertex. We see miniaturization. Most of the follicles are about, I would say, between 60 to 90 micrometers. We have few of those yellow ones that are below 60 micrometers, and not so many values here. The treatment were decided to be 6 PRP sessions, 1 month interval between one to another, and we gave him topical minoxidil and finasteride. Now, we have in Israel this nano-minoxidil, so it's a nanomolecule, liposomal minoxidil and finasteride, which has a really good adherence to the treatment from patients. Patients like it. It doesn't irritate the skin, it doesn't create scales and stuff like that. So this is a treatment. This is a picture after, so 3 months after the last session. So that will be 9 months into the treatment, and the outcome at 6 months was reduced shedding, increased shaft diameter, improved density, and high patient satisfaction. And this is his trichoscopy. This is the before and after 6 treatments of PRP. And this is the trichoscopy. So we increased the hair density, we reduced the interfollicular distance, and we increased the follicular width within about 60%. So this is a very good candidate for treatment. Now I'm going to show you a patient that she's not the right candidate for treatment, and I'm going to tell you why we decided to do PRP anyway. So my patient is 48-year-old. She has Ludwig between 2 to 3, more 3. Menopausal transition a few years ago. She's not taking any hormonal replacement, so she's in menopause with all the symptoms. And she has chronic thinning for more than 10 years now. As you can see, that there is a widening of the middle part of the scalp. The baseline finding was with moderate to severe miniaturization, reduced density. You can see we have some vellus hair here. It's in red. Evidence of chronic inflammation and evidence of vellus hair and fibrosis. We decided to do PRP induction protocol, so 6 treatments, and use topical therapy and nutritional optimization. I gave her biotin and B3, and I gave her folic acid that it was reduced. And I talked to her about getting some estrogen and progesterone. She didn't want to, unfortunately. It would help a lot. And the reason why we decided on PRP is because of money. 6 sessions of PRP is cheaper than in my clinic than SEFI. And I told her in advance that the result would not be as good as in SEFI. And she has agreed. This is after half the six treatments. So she has a reduced Shedding improved hair quality, but there is a modest density improvement, not more, with limited regrowth. Why the response was partial? First of all, she has a longer disease duration, more than 10 years. Second of all, she's in menopause for a few years now with no hormonal replacement, so there isn't hormonal influences, and there is a reduced regenerative reserve. So she would have been a good candidate for Sefi instead. This is the before and after. We can agree there is an improvement, but it's very mild. And this is the microscopy. Okay? So these are my cases.